Alright, hello, my name is Kaylee Croft, and in today's video I will just be doing a 30-minute video of me just talking about the CIA, kind of what I'm going to be going through, just so you guys know that I'm able to make a 30-minute video in case I have to redo it and send you a submission of 70 minutes or something like that. So yeah, okay. So for the head-to-toe assessment, we'll be given 30 minutes in the beginning to organize, then 30 minutes to assess, and then 30 minutes to write down our documentation. So in today's video, I'll just be kind of going over the 30-minute part of the assessment. And yeah, all right, so first I will wash my hands, doing the right technique, everything like that we learned in NFDN. Then after that, I will introduce myself to the patient. Hello, my name is Kaylee, and I will be your nurse today. I will provide privacy and ensure that the bed is in the lowest position, that the call bell is within reach, and the side rails are down. After that, I will use two identifiers to identify my patient, so that will be their first and last name and their date of birth. After they let me know that, I'm going to make sure I check for their LOC, which would be do you know where you are? Do you know what time it is? Do you know who I am? And then I've already got their self, which was their name and their date of birth. So after that, I would say patient was alert and oriented to time, place, person, and self. After that, I will do their pain assessment. So I will start with onset. When did the pain start? Then palliative factors. Does your pain increase with movement? Or is it just a constant rate of pain? Doesn't matter if you move, when you're sitting. Next would be quality. So can you describe your pain for me? Next is region or radiation. So where is your pain located? And does it radiate or does it just stay in one spot? After that, it will be scale. So rate your pain on a scale of 1 to 10. 1 being not that painful and 10 being the worst pain you have ever felt in your whole life. Then timing, so how long have you had this pain? And also, have any treatments worked for you in the past, or have you been trying anything to try to medicate this pain? After understanding, so what is your understanding of this pain? So what do you believe is causing this pain for you? And then value. What is your acceptable level for this pain? After that, I will move on to medications. So I will ask them if they are taking any medications over the counter, prescription, herbal, vitamins, recreational. After that, I will look at allergies. So are you allergic to anything in the environment, any latex, food, animals? If so, what happens when you get a reaction? So do you swell? Does your face swell? Does your mouth swell? Can you not breathe? How severe are these things? And then after that, I'll move on to vital signs. So for vital signs, you start with temperature. So I'll check their temperature either using a Tempadot or the thing we were given in the lab, the actual thermometer. And the average should be between 36 to 38. After that, I will check their pulse, and that should be between 60 to 100 beats per minute. Then their respiratory rate, which is between 12 to 20 breaths per minute. And with both pulse and respiration, I want to also note the rhythm. Was it bounding and regular, or was it irregular? Noting those abnormalities. And then as well, I would check their O2 saturation, which is between a 98 to 100%. And then last but not least, the blood pressure, which the range is for systolic is 90 to 120, and then diastolic is 60 to 80. After that, I will do general survey. So once I walked in the room, I already noticed their facial expression, body position, nutritional status, personal hygiene, and their speech. So then for general survey, I would just say probably 1 or 2 sentences saying that the patient's facial expression is calm, body is relaxed, or if not, the patient was stressed, or whatever the patient's facial expression was or body position. And then as well their nutritional status. So their so just inspecting and noticing their body, if they're underweight, if they're obese, if they look fine, if they look healthy. Personal hygiene, does the patient keep with their odor? Are they well groomed? And then speech, we already did LOC, so if they're able to communicate back with me, I know that their speech is clear and regular. After that, we move on to skin. So first we'll start with skin color and pigmentation. So do we notice any abnormalities about this patient? Does their skin color correspond to what I'm seeing? So for me, am I pink and warm, or am I pallor? Am I showing cyanosis? Maybe around my lips, is it blue? Or jaundice, are my eyes a bit yellow? Is my skin a bit yellow? Noticing that stuff. And then temperature, I would note temperature now, but I would already be checking it when I'm doing pulse. So the patient was warm and equal bilaterally. And then moisture, so the skin is moist to touch. There's no excessive dryness, no dry patches. And then I would test for turgor, which is like this, pinching the skin. If it goes back within 2 seconds, then that's a normal finding. If not, note the abnormality. After that, we would move on to the neurological system, which would be starting with the Glasgow Coma Scale. So when I first walked into the room, was the patient alert and orientated? Did they open their eyes spontaneously when I was talking? Or did it take them a minute to open it to my speech? Or did I have to pinch them? Noting that on a scale of 4 to begin with. So if they open immediately, I'd give them a 4. If they open to my speech, 3. Open to pinching them, giving them a little pain, 2. And then no response would be a 1. Next would be motor response. So asking the patient to, when I put my fingers out like this, could they squeeze my fingers? Can they pull them towards them? If they can follow both commands, I'd give them a 6. Then noting down localizing pain, 5, flexion withdrawal, 4, flexion abnormal, 3, extension, 2, and no movement would be a 1. Verbal response. So are they able to communicate back to me when we're doing LOC? Were they able to give me correct verbal responses and cues? If they were, I would give them a 5. If they were confused, I'd give them a 4. If they were using inappropriate words, I'd give them a 3. Incomprehensible, 2, and then no response is just a 1. So then out of 15, I would either rate them 15 out of 15, or whatever their category was, their scale, I would just rate them out of 15 based on what they got. Another thing for the neurological system would be the pupil size. So taking my pen light, going over each eye and checking the size, noting if it's sluggish, normal, fixed, or unable to assess. And I would do that for both of the eyes. Afterwards, I would then check their upper and lower limbs, noting for just the responses on those. So again, if they were able to pull and push my hand, pull my fingers towards them, I would note if it was strong, moderate, weak, absent, abnormal, spontaneous, or withdrawal. So I'd notice those things in the upper and lower. So then for lower, maybe asking them to flex their feet and me pushing on their feet. And if they can resist, noting the strength. Was it normal? Were they able to resist? And then noticing the strength if it was equal bilaterally or irregular. Next, we're moving on to respiration. So is the client on room air? Or are they using oxygen? Are they using accessory muscles when they're breathing? Noting those things. Take a deep breath and cough for me. Do I notice any mucus? Note the color of that as well, and notice the amount. If a lot's coming out, note that. Then I would inspect. So inspection consists of 2 parts. So first I would inspect posteriorly, and inspecting for if it's symmetrical, if the chest is symmetrical on the back, posterior chest is symmetrical, no lesions, no bumps, no edema. Noting the anterior or the anteroposterior diameter compared to the transverse diameter. Is the ratio 2:1 or is it equal? Noting if they're using any accessory muscles. And then I would auscultate the posterior side first since I'm already on there. I would auscultate 18 breath sounds in the back, going from left to right, and noting if there's any wheezing, any cracking, any gurgling, uneven sounds, if it's effortless, regular. Then I would move on to the anterior chest, doing the same thing, so noting if there's any lesions, bumps, edema, noting the color, is there any blue color compared to what it normally was when I first checked their skin. Then I will auscultate the 10 breath sounds on the front. Same thing, moving from left to right. And I would make sure that there's no presented wheezing, crackling, gurgling. All sounds are even, smooth, regular, effortless. Then moving on to cardiac. So I am going to stand on the right side of the bed. I would first inspect. So although I already inspected for the posterior or the anterior chest for respiration, I would just say again, I've already inspected the chest, and I noted that there was no cyanosis, there was no jaundice. Sorry about that. Then, just noting the color, if there's any inflammation, lesions, and then after I would auscultate. So when auscultating, first we want to find the rhythm of the appendix, and then noting if that is regular, irregular, or regularly irregular. So first I will feel the appendix between the angle of Lewis and locate the xiphoid process, and slide my fingers down to the left side to the fifth intercostal space to between the midclavicular line, and check for the apical pulse. I will do that for 1 minute, and then if I'm unable to feel for it, I would ask them to lean over to the right side a bit more for me to get a better angle. Noting if it is bounding and regular or if it's weak, noting those different abnormalities. And then I would check apical versus radial pulse and the time between each one. So palpating your apical and radial pulse, I'll feel for the time in between each pulse, just making sure they should be at the same rate and rhythm. Then I will auscultate for the 5 heart sounds. So aortic, tricuspid valve, pulmonaric, Erb's point, and the mitral valve. Noting that the aorta is at the second intercostal space on the right, pulmonic is at the second intercostal space at the left, tricuspid is at the 5th intercostal space at the left sternal border, and then the mitral valve is on the 5th intercostal space between the midclavicular line, as well Erb's point is on the left at the 3rd intercostal space. I also want to note and explain that S2 is louder at the apex, or S1 is louder at the apex, and S2 is louder at the base. Then I will check for capillary refill, pinching their fingertips. If we notice that the blood can go back within 2 seconds, that is normal. 2 seconds or less. Then I will check for pretibial edema, noting left and right, and grading that on a scale of 1 to 4. Palpate the posterior tibular pulses. I'm going to feel the back of your knees for a pulse. I'm also going to feel if there's any pressure ulcers, and then grading that also on a 1 to 4 scale. Noting the pulse was bounding, regular, irregular, whatever you found there, and then as well the dorsal pedis on both right and left feet. Palpating both of those, and it is predicted that those will be weak and regular on both sides. Next, I will move to the abdomen, inspecting the contour if the abdomen is flat, rounded, protuberant, and then noting any lesions, bumps, local edema, or discoloration. After that, I will auscultate the bowel sounds in all 4 quadrants, starting at the right lower quadrant. At the ileal valve area where the most sounds are heard. And then moving to the right upper quadrant, then the left upper quadrant, and the left lower quadrant. Listening to the bowel sounds in all 4 quadrants for about 30 seconds, and then noting if it's regular, if I'm hearing sounds between 5 to 30 per minute. Then I will lightly palpate each 4 quadrants, noting for and feeling for any superficial muscles, keeping my 4 fingers flat against the skin to avoid a stabbing motion, just in case the patient is feeling pain or tenderness. And then, yeah, that's basically it for that. So I will also ask them about their bowel patterns. So do they poop regularly? When was their last bowel movement? After that, the genitourinary system. So again, asking if they're voiding regularly. How many times a day do they urinate? What is their intake and outtake of fluids like? Do they drink a lot of water? Are you maintaining your hydration or losing hydration? Do you feel dehydrated? And then I would also ask them for the color of their pee recently, if it is clear, if it is really yellow, noting that yellow is normally caused by dehydration and clear means you're getting enough fluids. And asking them, do they notice any cloudiness, anything like that? Blood maybe in their urine. Then I would move on to musculoskeletal, which would be inspecting the size, the contour, color, swelling, deformities of muscles, the joints. I'm going to look at the tone and size of your muscles. And then check for any swelling. Maybe they have arthritis. After that, maybe palpate each joint, noting for tenderness, heat, swelling, masses, and then assess the range of motion. When assessing the range of motion, you can either do it where you incorporate it throughout the whole head to toe assessment. So say you're giving a blood pressure, asking the person to extend their arm and then flexing it when they're relaxing. Then you could note that. As well, when you're checking the abdomen, when they're laying down and you're palpating, once they get up, you could note that as well. Also, when they're laying down, asking them to bend their knee, flex their knee, checking that range of motion and then noting that as well. Or you can just go straight from the checklist that we have here, and it does say, okay, now assess the range of motion. So one range of motion, like flexion. I'm going to flex and extend this certain part of your body. So then you could say, okay, at the shoulders, can you scrunch them up? Can you put them down? Can you move your arms to the back for me? Can you move your arms to the front? Doing different motions like that. I also have here for elbows, if you didn't want to do that, you could literally just ask them, can you flex your elbow? Can you extend it out? Flex it back, for knees, again, asking them to lay down, extending their knee. Hips, can they put one leg out to the side? Can they bring it back? Adducting and abducting, right? And just checking the range of motion. Are they able to fully move their extremities? If not, note that. What else can I talk about here? Closing. I would just make sure, to thank the patient for their time, ensure that the safety is back up. So bed is in the lowest position, but we're going to be putting the bed rails up so they're not going to fall off, and making sure the call bell's within reach for the patient. Things as well I want to note throughout doing this whole examination. Washing my hands every time I'm touching a new piece of equipment. Going back and touching one thing, going back and touching the other thing. Always washing my hands, because we don't talk about that lots, but it's really important that I do that. So then they know that I'll do that in clinical or whenever else I have to do this. And then, for myself, just practicing on my family members, practicing my vital signs, getting good at really listening to it, really knowing what to listen for, knowing what's regular, what's irregular, verbalizing everything, not having to constantly read off my sheet. I definitely need to practice more. If I'm doing a reflection of practice right now, I for sure need to practice more on somebody else rather than me just reading off of my checklist or my organizational plan that I made for this CIA. Other than that, today in the lab we talked about knowing 3 generic subjective questions to ask, because we're just doing a head-to-toe assessment. It's not going to be really generalized on or focused on one body system. So maybe asking the patient, what's your diet like? What do you eat every day? What's your normal eating habits look like? Are you getting enough protein? Are you focused on what you're eating, or do you just eat whatever you want? Maybe do you have problems getting up, going to the washroom like we talked about, right? Their ADLs, like are they able to do activities of daily living? Can they call somebody on the phone? Can they make their own food? Same thing like with diet. Are they making their own food, or are they just ordering it? Are they able to get up and perform those activities? What else do I got here? Oh, remembering to use a black or blue pen. I always use a pencil. Constantly. Always use a pencil. And even in the documentation I handed in, I almost used a pencil. I had to go over it a few times with my pen because I always make mistakes sometimes. So just in the documentation room, I think just really focusing on making sure that I cross things out if I put the wrong thing, and then just writing it again. Maybe getting some extra pieces of paper because I do write a lot. And then again, when I'm finding all these, when I'm finding all the information for this assessment, making sure I go back onto my organizational plan and writing what I find so I don't have to remember at the end. Really managing my time that way, and I think practicing will really help me out with that. Having a pretend organizational plan next to me, having what I'm going to be probably bringing into the assessment next to me when I'm practicing on someone, and then listening to what I find, quickly writing that down, and then talking, and then washing my hands again. Just having that all there for me, I think will really help me for this CIA. Being organized, bringing anything I can into the first 30 minutes of planning, right? The organizational plan that I've made. My textbook maybe my little pocket book, or what's it called? This book. We have the laboratory manual, right? There's a lot of things in here that could definitely help me out if I need. I forget any specific words, or I need any different, if I'm missing something, from my organizational plan, which I really shouldn't be because I think I planned it out very well. If I do miss, why not bring all the things I need? Also remembering to bring my stethoscope, my pen light, the whole HEAS kit that we got at the beginning of the year. Making sure to bring a watch. Second person hand watch, or whatever it's called. Stuff like that, and just, being organized, having everything planned. I really think I should be good. I just gotta practice more. I think that's it. I hope that this 30-minute video is educational. I'm not really too sure what else to say, but yeah, just want to get through it. What else do we got in here? Yeah, I'm just figuring out how to put everything together. So if I choose to do range of motion throughout the whole head to toe reassessment instead of just doing it at the end, maybe planning that out before I get there. So like on my organizational plan, I'll write down, okay, this is what I'll do for this one. For this one, okay, now check the range of motion for blood pressure, so arm. And yeah, laying down in the abdomen, like checking that range of motion with the knees maybe, and just noting those little things. Unless I want to do it at the end, which might be a better idea. I need to practice, I think, a few times to see which one I like better. Yeah, other than that, not too much else to say. I will let the time run here. I'm waiting for my HEAS mark. My midterm, or I mean my final. It's still not up. It's a bit stressful. I still have like 4 minutes or something, so we'll just put the camera up here and yeah, I don't really know what else to say. Just working on an NFDN assignment that is due in 2 days. 3 days? 2 days? I think 2 days. It is the care plan template form. Yeah. Assessment, first diagnosis, second diagnosis, priority diagnosis, identified, planning, first nursing intervention, second nursing intervention, third nursing intervention. Lots and lots of work here. I'm not too sure. Is there a... Okay. Oh, we get to pick our own scenario. There's 3 to pick from. This looks really easy. I'm excited to do this. What is this part? Interesting. It has to be 30 minutes. If this whole assessment is 30 minutes and I can get it done that fast, I'm gonna be solid. I just have to actually practice auscultating and listening to the sounds, I think, because my ear is kind of messed up, but that's